Welcome to Adapt NCLEX Commonly Tested Questions and Answers version 19. Let's get to it. And let's provide care for a client with this EKG strips, heart rate 110, blood pressure 120. What should the nurse expect for the initial management of this question? Break down the question, go back and look at it. What should you expect? Patient blood pressure this, heart rate is that. And they give you EKG. Look at the rhythm. Is it regular? RR interval is not. Is there any P wave? No. These are all T wave. Therefore, this is AFIB. Management of AFIB, number one is rate control before anticoagulation. 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 Isosorbate will decrease the blood pressure and make the individual unstable, requiring cardioversion. Therefore, the best answer is amiodarone, which is an antiarrhythmia that will decrease. It will convert it to a sinus rhythm and patient will be fine. Select or apply. Which of the following information place the client at higher risk of colon cancer? That means which of these 40-year-old clients who present with asking for colon cancer screening risk factors, which one place this individual at highest risk? History of ulcerative colitis will do that. Crohn's disease will do that. If you have a first-degree relative who had cancer at the early age, will do that. Irritable bowel syndrome is not a risk factor. If your sister, first-degree relative, has a polyp at the age of 40, will do that. So 1, 2, 3, and 5 are your risk factors. The client with profuse watery diarrhea, abdominal pain after anti-infective therapy for cellulitis diagnosed with C-diff. Which prescription the nurse should expect? This is test-taking strategy. I try to confuse you. You can take all this out, the first portion of the question, and then forget about it. It's irrelevant. All I'm saying is this individual has C-diff. So when they give you a bunch of this, look at the keyword. That is the buzzword. You have C-diff after I treat you with some antibiotic. What would you do? Treat it with another antibiotic. Motrin is not useful. This is a major antibiotic, especially first generation and cephalosporin and second and third. They are major cause of C-diff. So cefepime, ceftriaxone, which are all third and fourth generation, bad. Therefore, test-taking strategy, you left with Fidaxomicin. This is what is normally used for treatment of C-diff, or Vancomycin. That's what most people know, or Metronidazole. These are used for C-diff. If you don't see that, if you see this answer choice here, it's used for C-diff. Which of the following the nurse should monitor in a client receiving niacin? A nurse has attended staff education program on vitamin B3 deficiency treatment. Which of the following the nurse should expect when you monitor for this patient requiring receiving this medication? So vitamin B3 is niacin. If you have deficiency, you have 3 Ds. I call it peregrine. Right? You have peregrine, dementia, and then diarrhea, excessive diarrhea. So there is 3D, which you have what? Dermatitis, diarrhea, and dementia with this problem. If you're replacing the individual with niacin, the major problem associated with this is it will make you increase your sympathetic nervous system and dilate your vessels. Therefore, you're going to have flushing, no leg pain, no angina, no pneumonia. The major problem associated with this is flushing. So this is your right answer. A client weeks old gestation is due for vaccination. Which of the following may be administered safely and appropriate? So when you see this, you got to think really carefully. I say a client, she's 30 weeks old. Why would I give you a pregnant patient? You ask yourself, and I said the patient needs vaccination. Think about it. And I give you a bunch of vaccination. And I said, would it be safely? Something should trigger test-taking strategy of online buzzword. Something should tell you one of these medications may not be safely administered. That means a live vaccine. Any live vaccine, then patient cannot receive it. Tetanus, they can do that. Diphtheria, IM flu vaccine, no nasal, right? That is okay for the patient. HPV is a live vaccine. Pneumococcus is not alive. Haemophilus is not alive. And meningococcus is not alive. Therefore, the pregnant lady can receive 1, 2, 3, 5, 6, 7. A B, HPV is a live vaccine. Nasal flu is a live vaccine. Oral polio is a live vaccine. MMR is a live vaccine. Varicella is a live vaccine. Those are common live vaccines you should know. And let's provide care for a client with acute gout flare-up. Which of the following is most important to include in the plan of care? People made a mistake all the time. Acute gout is due to uric acid, excessive, right? Therefore, in order to prevent you having a flare-up, we give you something, allopurinol, to prevent breakdown of that, right? But when you develop acute problem, we cannot give you any more allopurinol because it's too late. It's for acute. It's used for long-term management. Niacin will increase your uric acid and it causes more acute gout. Hydrochlorothiazide will increase your uric acid and causes more gout. Colchicine is your best treatment. So when you see a question about acute gout, it's colchicine. If it's a chronic, you give them allopurinol. Which medication you should avoid? This and that. And niacin and hydrochlorothiazide because they increases your uric acid and it can precipitate gout. And let's provide care for a client with aplastic anemia. Which of the following laboratory work is consistent with this condition? This is a test-taking strategy and concept. Aplastic anemia means you have myelosuppression. So your bone marrow cannot secrete RBC, it cannot secrete WBC, it cannot secrete platelet. So production of this is all decreased. Your hematocrit is not going to be elevated. Your hemoglobin is not going to be elevated. Your platelets will go down. You're going to have neutropenia. It does not affect your coagulation. So PT, INR, which are related to coagulation, it does not affect. So the only answer choice is number 4. Number 4 and 3. Don't over-select too much. So 4 and 3 are your right answer. And as provide teaching to a client with left ankle fracture, prescribe cane. Which of the following statements by the client indicate need for further teaching? How do you use cane? Think about it. This is the leg, this is the left, this is the right, this is affected. You hold the cane on the unaffected side. The cane and the affected side move together all the time. I will keep my elbow at 25 to 35 degrees. I will move the cane and the right leg together. The cane move with the affected leg. So this is not good, right? Which of the following statements by the client need further teaching, right? So put a selected apply here. I will hold the cane on the left side. You hold the cane on the right side. So this need further teaching. I will move the right leg last. So the right leg is going to be the last thing you move. You move the cane and the left leg together and the right leg follow, right? Your elbow has to be at 35 to 25. You're going to move the what? The cane and the left leg, not the right leg. I will hold the cane on the right side and then I'll move to this. So it's a selected apply. So 1, 2, 3 are your right answer. And let's provide care for a client with bipolar disorder in acute mania, right? So bipolar disorder in acute mania. So the patient is in acute mania. Which prescription the nurse should expect? It's a bipolar disorder. You got to stabilize their mood. Therefore, pick a mood stabilizer. Diazepam is for anxiety, right? Valproic acid will stabilize your mood. Bupropion, you should avoid it in them because it increases your activity. So if you increase your activity, these people, they already hyper. They're going to go up too much. The same thing, methylphenidate is the stimulant. You're going to go too much up. Therefore, the right answer is a mood stabilizer. Number 2, valproic acid. And let's provide care for a client with new diabetic nephropathy. Which prescription the nurse should expect? Nephropathic means the kidney is failing and there's leakage of protein. right? The best medication you can use to help with the nephropathy is an ACE inhibitor. So ACE inhibitor is the best medication to do that. It's known to treat that problem easily. These are all diuretic. They don't provide any protective effect. The ACE inhibitor, every diabetes patient have usually on ACE inhibitor and allopurinol ACE inhibitor. This will prevent what? And decrease the diabetic nephropathy. Take care of yourself, and thank you for watching. Best of luck.